Welcome, everyone, and thank you for joining us today. It is my distinct pleasure to introduce my friend, Tanya Lubner. Tanya is the Director of Education at the Water Quality Association, and she's the reason why I'm so excited about education and certification in the field of water quality management. Tanya's been with the WQA for a number of years, and her vision and insight has allowed for WQA education to be adopted in a number of forums where it has not had adoption before, and it has helped raise our industry to a higher standard. Without further ado, Tanya Lubner.
Thank you, Greg. I'm thrilled to be here with you. And today I'm going to ask the question, is point of use, point of entry water treatment the next Apple? So what do I mean by that? Remember, you know how everybody likes to talk about or says that they wish that they were able to get into at the ground level for stock that's really done well? Well, here's Apple stock prices, and somewhere around 2000, stock prices were about $7 a share. That was the ground level. We're seeing some trends right now in water treatment, in point of use, point of entry water treatment, in legislative attitudes, in attitudes from the health departments from the various states, that suggests that now is the ground level for changes in the acceptance of point of use, point of entry water treatment for dealing with health-based contaminants. This is also your opportunity to get in at the ground level, especially with professional certification. We've all seen the news stories. We know that the focus is changing. It's not about just hard water anymore. It's not about just iron. Heck, it's not even just about nitrates anymore either. That's old hat. We're dealing with PFAS, arsenic, lead. Since Flint, Michigan, that has been the leading story all over the country. Disinfection byproducts continue to be problematic. And legislators and health departments are giving serious consideration to using point of use and point of entry technologies for compliance with drinking water regulations for small systems, and of course for private wells as well. Here are some examples of those changing attitudes. There's been actual research recently that shows that centralized treatment is limited. It's not taking care of the disinfection byproducts. In fact, half the time it's not quite half the time, but sometimes it's also not even delivering the disinfectant residual that it's supposed to. Corrosion in the distribution system as well as in premise plumbing continues to be a problem for centralized treatment, and one that they have not been able to solve successfully. There's also been research that shows that point of use and point of entry water treatment technologies can be cost effective for very small systems. There's been research through WQRF looking at lead and arsenic treatment. And there's been research from the US EPA. In fact, that's what we're looking at on this slide. When looking at nitrate treatment and considering a point of use membrane system, an RO essentially, as well as point of entry with anion resin, when the US EPA looked at cost effectiveness of this treatment in households, in small systems with 25 households, they saw that it was much more cost effective than their centralized treatment. Likewise, it continues to be more cost effective, going up to almost 1,000 households. We're seeing new legislative initiatives. We are waiting for the update to the lead copper rule to come out, but part of the proposed updates for that rule include allowing schools to use point of use and point of entry treatment as a permanent solution, not just a stopgap, but a permanent solution for addressing lead. WQA has put out the Clean Water for All initiative, which is gaining some traction federally. And likewise, there's the California Safer program, where money is being put aside and for underserved communities to be able to use point of use and point of entry equipment to improve their water quality. As of September 22nd, as you will have heard in Kathleen Burbidge's update from WQA's Government Affairs, there are approximately 215 bills or pieces of legislation that are being considered at various states. Over a third of these is focusing on unregulated contaminants, and 65% of those are looking at PFAS. Another third, more than a third, is looking at lead. And again, with what we know now, with the challenges to centralized treatment, point of use and point of entry is starting to look like a better and better solution. Here's an example of one of those pieces of legislation. The state of Michigan has created new PFAS standards in drinking water. So they have launched a state MCL in the absence of a federal MCL. And this applies to all public water supplies, including the community and non-community systems, both the transient and the non-transient. What is a non-transient, non-community system? It's an office building, it's a school. What's a transient? It's a campground or a gas station. All of those applications are ones that water treatment, point of use, point of entry water treatment industry members work with on a regular basis. So this is very much in our wheelhouse. And WQA staff has been, members as well, have been active in promoting the industry as well as the expertise of our industry members. We've done it at the federal level, and we're also getting involved with the National Environmental Health Association, state health departments, the ones that are going out and working with private wells and assisting homeowners with getting their water tested, and then trying to understand what treatment they need and who they can go to for that treatment. In fact, we've made our case so well that New Hampshire's Department of Environmental Services links directly to WQA's Find a Certified Professional website. So what you're looking at is the end result of a water quality and water contaminant identification tool where consumers can enter in their results of their water report on the New Hampshire website. And after they're given some advice on what type of water treatment technologies they should consider, they're also pointed to certified professionals. This link goes directly to the WQA certified professional listing. A number of states are using WQA training materials for licensing. WQA does the non-transient, non-community public water supply operator training for Illinois. Certified water specialists and certified installer certifications are accepted in Colorado in lieu of having a master plumber on staff. We work with Wisconsin for their specialty license. We're currently working with the state of Oregon for the same. And of course, California, the C55 license exam comes right out of WQA's online knowledge base. And if you're going to the trouble of studying the online knowledge base for the C55 license, well, why not take advantage of the modular education program, which walks you through that knowledge base, and get your certified water specialist designation as well. Because once you have that designation, we do offer a number of pointers to it to help consumers find you. And a great example is our betterwatertoday.org, which is the recently launched WQA website for consumers. And notice in the top right, we immediately refer consumers to finding water treatment providers. And our water treatment providers list indicates who has certified personnel on staff. So when the consumers go to this certified professionals list, when the health departments go to the list to look for a partner, when the legislators go to that list, is your name going to be there? Are you going to be at the ground level? Now's the time. So how do you get there? To become certified through WQA, you need to complete the appropriate modular education pathway for your certification. There's information on our website at wqa.org/MEP. If you're brand new, you would need to do the full path. But if you have time in the field, if you have experience, we do have some shortcuts because we give you credit for that experience. We know that learning on the job is critical. Will this take time? Yeah, it's going to take some time. This is not easy. It's not meant to be easy. We're dealing with people's health, more so now than ever before. So it should take time, just as anything worthwhile does. How much time will it take? It's going to depend on the pathway that you're on and on how much time you're able to devote to the training on a weekly basis. We've seen people go from 3 months to 18 months to complete the program. And we do offer a tracking tool. It's called our Learner Progress Tracking Tool. You'll find that on our website. It's wqa.org/MEP/support. And on that tool, you'll be able to see what you'll be doing on a weekly basis, and you can plan your time. Some weeks you'll have more time, some weeks less, but it'll give you a very clear idea of how you should be progressing. I mentioned a couple of research articles and research efforts earlier on. I wanted to make sure that I provided you with the references should you care to read more on any of these. And then if you have questions or need more information on the MEP program, professional certification, or really anything WQA, please contact us at education@wqa.org.
Thank you, Tanya. That was very enlightening. As a personal note, getting certified personally and having our employees certified has been a significant benefit to our businesses. We track our lead sources, and approximately 14 to 16% of our lead sources come in now because they were looking for somebody who was certified. They either came in directly through the WQA website, or the fact that we list our certified status on our own website, and they found it through Google. So the credentials, I think, are worth now more than ever before. And I think somebody would be quite foolish not to get in at the ground floor.
Absolutely. And you know, when consumers call us, we take them right to that Find a Water provider. We explain to them about professional certification and what that means. And in fact, that information is going to be added to the consumer website as well, in terms of why work with a certified professional.
That's a great idea. For someone to have the peace of mind knowing that the man or woman coming to their house has the skills, the knowledge, the expertise that's being independently third-party vetted, I think is great peace of mind for them. Mm-hmm. And as far as dealers that have been in the business for a long time or field workers that have been doing it a long time, would you mind telling everyone a little bit about the accelerated path so that they can learn about it? I don't think a lot of people quite understand how that works yet.
Sure. When we put the MEP together, we wanted to provide a stepwise pathway for somebody who was brand new. And obviously, someone who has experience on the job doesn't need absolutely everything that we put in. So the accelerated paths skip over certain things like how do you take a water test? You know, we kind of expect that someone who's been in the field will know how to do that. But we do want to see examples of how well they understand, for certified water specialists, for example, how well they understand treatment trains, how well they know product or problem water. So we do require still some completion of those activities, as well as examples from the field of those activities. And actually, that's one of the biggest changes with the MEP versus the way we used to do certification, is those field activities. And we put them in because we could see this coming. We could see the change in the legislation attitudes. We could see the change in the health department attitudes. And we knew that they needed an extra level of reassurance that not only did someone read a book, pass the test, but that they have the experience, that they are capable of doing what they're saying they can do.
That makes a lot of sense. And again, personally, we like to use the MEP as part of our onboarding and continuous education with our employees, because then we ensure that everybody gets a uniform baseline. Going back to the experiential segment where people can take that faster track, there's no extra charge. They don't have to pay extra for the privilege of going through it faster. They just have to prove that they know what
they actually have the privilege of paying less.
Even better.
Yeah.
Oh, that's great. So everyone listening, please, if you're not certified, get certified. If you're currently certified, get more certifications and encourage more people to do it. As an industry, a rising tide raises all ships, and it's best for us to acquire the knowledge and then prove that we know what we know so that we can improve our industry and, most importantly, bring more, better water to more people. Tanya, thank you again. You've got a busy schedule. I appreciate you carving some time out to spend with us, and we're very grateful for the hard work.
It's my pleasure to be here, Greg. Thank you.
Thank you very much.